Hey there, my name is Autumn Kaiser. I'm a nurse here at Floyd Medical Center and I'm your spine coordinator. I'm going to take a few minutes to go over some discharge education. The first thing that we like to talk about with our patients is going to be related to your medications. Patients that come in and have spine surgery have to hold blood thinners, as you know from your pre-op evaluation. So we're going to give you instructions on when you can resume those blood thinners safely after your surgery. Most patients are able to resume their blood thinner within 5 to 7 days from their surgery date. Your surgeon or your nurse will provide you with the exact date and time that you are able to resume those blood thinners. Also, a medication to be aware of while taking it home is going to be anti-inflammatories. These are medications like ibuprofen, Mobic, naproxen. Those kind of medications can actually interfere with your surgery if you've had a fusion. We do ask patients to try to limit those medications so that they are not taking too many and potentially hurting their surgery down the road. Those are the only guidelines we have for your home medications. All of your other home medicines are safe for you to resume as you were taking them prior to surgery. We will provide you at discharge with a prescription to go home with. That prescription is going to include pain medication, a muscle relaxer for any spasms that you may experience, and also a stool softener. The number one side effect of pain medication is constipation, which is why we advise that patients take a stool softener to prevent the need to strain after spine surgery. So next we're going to move on to your incisional care. Patients that have spine surgery most of the time are going to be covered with a glue type dressing. This dressing is referred to as Dermabond and it is waterproof and designed to stay on for up to 2 weeks. Over the course of 2 weeks, that Dermabond glue will start peeling up, drying and flaking off of your incision. Let it do it on its own time. We don't advise for you to take it and peel it off. We actually prefer for it just to be left alone. You were able to start getting a shower on post-op day 2 after your surgery. Your shower is going to allow the soap and water to just run over that incision. We don't want you to do any kind of scrubbing, and we also prefer that you pat the incision dry once you get out of the shower. While showering is safe over the Dermabond glue, we do not advise that you sit in a hot tub, bathtub, or swimming pool. Submerging the incision underwater for a period of time can put you at risk for an infection. So showers only, no tub bathing for the time being. You'll get further instructions on your wound care when you see your surgeon for follow-up. A small population of our patients may have staples or stitches to close their incision. If you're one of these patients, the care is very similar. You will simply shower and let the soap and water run over your incision, and you will have a 2-week follow-up to get those staples or sutures removed at your surgeon's office. There's no need to put any kind of cream or ointment on top of your incision. We actually prefer that it stays dry. You do not have to keep your incision covered with any type of gauze or tape as long as the incision is not leaking. It can be left open to air. For those of you that had a surgical drain during surgery, the drain is going to come out before you're discharged per your nurse. The drain tube, when it leaves your body, it does leave a little tiny hole about the size of an ink pen where the drain tube was placed. That hole will grow back together, the skin closes, but it can take up to a week for that to happen. So we ask that you use some Bactroban ointment or Neosporin type ointment and put over your hole where the drain tube was and cover that with a Band-Aid. Your nurse will do that for you when they pull the drain tube out, and you'll need to do this once a day for the first 7 days after your surgery. This is to prevent any kind of bacteria or infection from getting down in the hole and causing potential problems. Once the hole is closed up, you do not need to place the ointment on any further. Also, be careful not to make sure that any of the sticky part of the Band-Aid touches the glue that's covering your incision. If this happens, it puts you at risk to peel that glue up prior to it needing to be done. This is an important thing to make sure that you know and also your coach is aware of, as they will be helping the patients that have back surgery with the ointment and the incisional care. Okay, we're going to move on to prevention of infection. You have been using your incentive spirometer, your breathing buddy as we like to call it. So that incentive spirometer is there to prevent pneumonia. Our lungs get lazy after surgery, and so we use this as a way to exercise our lungs. You're going to need to take this home with you and use it for 1 week after surgery. Patients will need to use this device about 10 times an hour while you're awake. So during the day, make sure you keep it with you. A good hint for our patients is if you're watching TV, you can use the incentive when a new commercial comes on. You'll easily reach the goal of 10 at that time. Inhale in on the device, hold your breath for just a second, and then exhale. That's going to prevent any kind of bacteria from getting in your lungs. The number one cause of low-grade fevers after spine surgery is from your lungs. So this is an important measure to make sure you're preventing that. Low-grade fevers can be normal after any kind of surgery that you have. Only call your physician's office if your fever is over 101.5. Another good activity for you to do while you're recovering from your spine surgery is to do what we call leg pumps. Circulation in your legs. This is to prevent any kind of blood clot from forming in your legs after surgery. We've been working on this at the hospital, but you should continue to work on it at home for the next week. You can simply rotate your legs around or pull your foot up and down, and that's really going to focus on circulation in your lower legs to prevent blood clots. These are tips that you can do to further prevent any complications from occurring after spine surgery. Okay, so you're going to have a follow-up visit with your surgeon in 1 month. At the 1 month visit, they will give you further instructions on your care. We're going to have our therapist go over your activity restrictions to make sure that you have a good understanding of what you can and can't do following spine surgery.
Hello, I'm Molly, one of the physical therapists here, and I'm going to go over your precautions. You have 3 main precautions: no bending, lifting, or twisting. So what we're going to do is going to break those down. So first is bending. You want to avoid repetitive bending. So no bending down and picking things up off the floor. And as far as getting dressed, you want to cross your leg over here to get dressed on both sides. If you have to pick something up, it's okay. You just don't want to repetitively bend down over and over again just to protect your back. The next one is lifting. You do not want to lift more than 5 to 10 pounds or a gallon of milk. Be careful reaching up and pulling things down from the cabinets or pulling things up from the floor. You want to be very careful, especially our patients that have had cervical surgery. Those are the main precautions for you. Your next one is twisting. For bed mobility, we want you to perform a log roll. You're going to bend your knees up and roll all the way to the side all together. That way you're preventing any of this twisting of your back. For the patients that are in Aspen collars that have had cervical surgery, you are not allowed to drive while you're in that collar. So you are in your collar for 4 weeks until you follow up with the doctor. So you cannot drive during that time. For all of our other patients, you can drive once you're off the pain medicine. Once you get off your pain medicine and you're ready to start driving, you want to sit in the car and make sure you can look in both of the mirrors and see oncoming traffic, because we do twist a little bit when we drive. For those that have the Aspen collar, you have an extra set of pads in your room. You want to take those, and anytime that the pads here get dirty, you just want to take those off, rinse them in warm soapy water, let them air dry, and then replace the new pads on your collar.